and welcome to Nurse's Handbook. Today I will be talking to you about a special area of risk for diabetes, that is diabetic foot problems and its care. Diabetes can cause two problems which can affect your feet, that is diabetic neuropathy and peripheral vascular disease. Now let us discuss some common foot problems with diabetes. First one is the ingrown nails. It occurs when the edges of the nail grow into the skin, causing redness, swelling, pain, drainage, and infection. In some patients, the ingrown nails become infected with fungus, and this becomes discolored, thick, and brittle and may separate from the rest of the nail. Coming to the second problem, that is bunion, which is the progressive change in alignment of the toe joint. Base of the toe extends beyond the normal profile of the foot, as you can see in this picture. The spot where the big toe joins your foot becomes red and calloused. Now coming to the third problem, that is the diabetic ulcers. It is a break in the skin or a deep sore. It occurs from minor scrapes, cuts that heal slowly, and if it is left untreated, it may result in serious infections. Loss of sensation, that is neuropathy, makes diabetics more vulnerable to feet injuries and ulcers like this. Coming to the fourth problem, that is callus. It is the buildup of hard skin, usually underside the foot. It occurs as a result of wearing poorly fitting shoes or a skin problem, etc. Calluses at times may crack, and this crack allows the entry of bacteria which can result in infection. The fifth diabetic problem is cone, or we say hammer toes. It is caused by external pressure which build up a hard skin near a bony area of a toe or between the toes. Coming to the next problem is dry skin. When blood glucose levels are high, fluid is lost and dehydration leads to dry skin on legs, feet and elbows. So there is a need to prevent cracking in order to prevent infection. Now let us see some remedies, or we call it as the do's in diabetic foot care to prevent further complications, as a step each day can help keep problems at bay. The very first thing to do is inspect or check your feet daily, especially the bottom part of your feet with a mirror for cuts, blisters, redness, swelling, and also check for any toenail problems. If you have blisters, do not pop or break them as they can cause infections. Instead, one can use antibacterial creams, always keep the blisters clean, and one can use soft bandages to protect the skin. Now, what to do in case if you are having bunions? One may use felt or foam paddings, as you can see here. If it causes severe pain, do not go for any self-medication, rather you consult your physician. What is the remedy for dry skin? Use moisturizing soaps and lotions to keep your skin moist and soft. To prevent ingrown nails, check your toenails once a week. Trim your toenails with a nail cutter straight across. Remember, do not round off the corners of toenails or cut down on the sides of the nails. Now, what to do in case of corns and calluses? Use a pumice stone to gently remove the buildup of tissue, especially after taking a bath, as it makes the feet soft. The second do or care in diabetic foot is wiggle your toes and move your ankles at least 2 to 3 times a day for 5 minutes daily. Now the question comes, why there is a need to do this? It is to improve the blood circulation, as diabetes affects the flow of blood. Remember, do not cross your legs for longer periods. The third do's of diabetic foot care is shake out your shoes and feel for objects inside before wearing, as your feet may not be able to feel a pebble or other foreign object and can result in injuries to your feet. Always wear closed-toed shoes or slippers to prevent injury. Do not wear open sandals and do not walk barefoot even at house. Always wear socks or stockings that fit your feet well and have soft elastic. Remember, the socks should not be too tight, neither it should be too loose. Wear socks at night if your feet gets cold. Coming to the fourth do's of diabetic foot care, that is to wash your feet in lukewarm water every day, dry it completely, especially between the toes, and regularly moisturize your feet to avoid itching or cracking. Always check the temperature of water before washing your feet, that too with your elbows, not with your hands, because nerve damage can affect your sensation in your hands too. Do not apply lotion between the toes just to avoid fungal infections. And the fifth do is take care of yourself and your diabetes. Keep your blood sugar level within the range recommended by your doctor. So follow your doctor's advice regarding nutrition, exercise and medication. The sixth do's of diabetic foot care is to visit your doctor regularly for foot exams periodically to prevent any further complications. Thank you for watching. For more updates like this, do like, share and subscribe to our channel Nurses Handbook.